Okay, well we use it primarily to remind for appointments that we feel are important and where we don't want them missed.
Yeah.
So we're using them essentially for the nurse clinic appointments,
Yeah.
especially for immunisations,
Yeah.
cervical screening and health checks,
Right.
diabetes checks, those kind of appointments. So everybody attending a nurse-based appointment, especially where there's a larger amount of time, half an hour or an hour appointment, they will get a text to remind the day before automatically.
Mm-hmm.
Our counsellors will get all those patients because they're an hour long, so obviously that's important ones to do.
Yeah. Yeah.
So those are the main ones, and then there are some people that visit the doctor where you're pretty keen to ensure that they actually attend. We don't routinely remind for doctor appointments,
Yeah.
because most people have made them and would actually attend anyway. But there are sometimes situations where we want to be sure that person attends, so we put them on the nurse list, but as a marker reminder only.
Yeah.
So they get a text to remind because they're on the nurse list, but they're actually visiting the
Doctor,
Yeah.
right, yeah.
So we use them in that situation. I checked out with the nursing group this morning at Wicksteed, so that's about 10 nurses, and what was their experience. They're very positive about it.
Mm-hmm.
Report that they feel the reminder system has been very effective at encouraging attendance. The only issue that they raise is the issue around people texting back.
Mm.
So some of them send out the actual wording of the text, do not reply. But it has highlighted the value of a mechanism by which people can actually contact the surgery.
Yes.
by texting. We get very positive feedback. The nurses in particular say that people are appreciative that they have had the reminder.
Yeah.
The other situation that I didn't mention is also we run a smoking quit clinic, and we're using the texting to make contact with people after their initial consultation. So we get consent from them that that's an appropriate thing to do,
Yeah.
and then text them how are you getting on with smoking, encouragement and that sort of thing. So it's being used in that way. And of course the other way that we're using it clinically is to send results to people. Well, not the actual results, but a comment about the results. So where we have somebody who have a laboratory test where we don't need to see them for follow-up, the expectation is it's going to be normal. I say to them, would you be interested in getting your result by texting? And if they agree to that, we write in the notes, text result, and then when the result comes back in, send them a very benign text that wouldn't matter if somebody else read it, like, dear so-and-so, your results are all normal, catch up with you next time, Dr. John, something like that.
Yeah.
So that's good.
Put them out.
And from our viewpoint, I mean, that's the same amount of work as writing a letter, except you don't print the letter, you don't post the letter, and you don't have to go through the whole process of funding that letter. Well, all I can say is that in our region, we have 100% immunisation rate at 2 years at this point in time. It varies, of course, between 90 and 100% at different times, but right at this point we're at a very high percentage. So text to remind is clearly part of that process. It's part of a whole process of obviously managing immunisations, but it's an important part. I mean, I'm personally very keen to see patients able to contact the surgery in appropriate ways by texting, because it gives us the capacity to respond to those texts in a timely manner, but not right at that point in time. So I personally would like to see appointment requests coming in by text. It would need to come into a format that was easy to manage and where the response could be the appointment's made and you obviously click on an icon and out goes the response kind of thing. But that would allow people to make appointments with a huge reduction in our phone call time, prevent a lot of the stacking of phone calls which happens, and of course just actually faster turnaround time really. So that would be a positive thing. I'd like to see script requests able to come by mobile source. I think that would be a positive move as well. What we don't want to see is a whole lot of clinical requests come by mobile, because then we're in a position where we would have to give answers to insufficient information. So it's more around the admin side in that way, or the reporting back side.